Hi, my name is Andrew Green, PN student, and I'm going to be demonstrating a postpartum assessment. So before entering the room, the vital signs have already been done, and they look good. So I'm entering the room. I'm going to do hand hygiene. I've knocked. I've entered the room. Hi, Shirley. How are you today? You're okay? So I'm just going to get you to confirm your name and date of birth for me. Shirley Coast, yeah, 5/14 of 92. Perfect, so I have the right client. And Shirley, I see that you have some family in the room. Is it okay if I ask them to step out? Yeah? Okay, so her family has left the room. I have shut the door and pulled all the curtains closed for privacy. So I'm just gonna grab some gloves before I start my assessment. So Shirley, have you had any changes in your vision? Any blurred vision? Or are you seeing any rings around lights? No? Okay, good. Some women sometimes experience some changes in vision after delivery. As well, are you having any pain? You are, and where's your pain located? In your stomach. Is it a cramping pain when you're breastfeeding? It is. Okay, and have you had ibuprofen for that yet? You have? Okay, so I will go in a bit and check the MAR and see when you can have your next dose to try and help with that pain. So Shirley, I'm just gonna examine your breast because it says that you're breastfeeding. And how's that going? It's going okay? A little bit sore? Okay. So your breast looks good. Your nipple has a little bit of cracking, but that's normal. And I can get you some lanolin to help with that, and I'll look at the other nipple. And this nipple also has cracking, and neither nipples have any bleeding or excessive cracking, just a little bit, which is normal. So both breasts looks good, and I will get you some lanolin to help with that cracking. As well, the next time you feed baby, can you put your call light on so that we can come and look at the latch? Okay, perfect. So now, Shirley, I'm just gonna lay you back. And you had a C-section yesterday, so I'm going to assess your incision. And then you also had your catheter out yesterday, and you were voiding okay yesterday? Okay, and you're still voiding good today? Oh, good, okay. So I'm just gonna look at your incision, and how are you eating? You're eating good? And are you passing any gas? You are, okay. And have you had a bowel movement yet? Not yet? Okay, and that's okay because you're passing gas and you're eating. So the incision, the dressing is already off, and the incision looks good. There's no drainage. There's no redness. It's not warm to the touch. The edges are approximate. It's glued, and it looks really good. So Shirley, when you go home, you want to keep your incision dry and clean. So clean it when you're in the shower. Make sure it stays dry and clean. And if there's any changes in your skin color, so if it becomes red, warm to the touch, it starts to have drainage, or it's painful, call your surgeon. So now, Shirley, I'm going to massage your uterus to make it firm up. So I'm just going to pull down these blankets a little bit more, and I'm going to pull down your underwear, and I see that the pad has a scant amount of lochia rubra, which is normal. So I'm going to put my hand here for support, and Shirley, you may feel some cramping when I massage your uterus. This is going to firm up. So I'm going to leave the underwear down so I can assess for any clots or blood that come out as I'm massaging. So I'm going to start massaging at the umbilicus, and it's starting to firm up, and I can see that there's a little bit of blood coming out. So now that the uterus is firm, and there's a little bit of blood that came out, which is good, and the uterus is 1 finger width down from the umbilicus day, which is normal as it's day 1 after delivery. So then, if she needed to go to the washroom, I assist her to the washroom and help her change her pad there, or I could change her pad here if she doesn't need to go. So now we're going to switch to a vaginal delivery. I've done hand hygiene. I've changed my gloves. So I'm just going to move these blankets so I can turn her a little bit easier. Okay, Shirley, so I'm going to assess your tear, so I just need you to turn to your side. Okay. So I would spread the buttocks and look at the tear, and I see that the edges are approximate. There's no trickling blood. There is a little bit of swelling, so I'll get her an ice pack for that. The laceration looks good. So then I can roll her back. And again, change the pad if needed or help her to the washroom if needed. And I'll cover her back up. Okay, Shirley, so when you get home, your blood in your pad, if it is brown and it goes back to red, or it changes color backwards, then phone your provider. And as well, if you have any clots bigger than an egg size, you also would want to phone your provider then. So I've changed my gloves again and done hand hygiene. I'm just gonna assess your legs, Shirley. So Shirley, your legs look a little bit swollen. Do they feel swollen? They do, okay. So I'm just gonna assess for pitting edema. And it looks like she has 2+ pitting edema bilaterally. And I'm also gonna assess her pedal pulses. Okay, and her pedal pulses are also present bilaterally and they're equal. So I can cover Shirley back up. Okay, Shirley, everything looks good. So it's normal for women to experience some mild sadness when they get home from the hospital, usually for about 7 to 10 days. But if you have any thoughts of harming you or your baby, call 911, and if your sadness persists, then make an appointment with your provider. And then I'm going to go and get you some ibuprofen if you can have another dose now, and I'll come back and also get you an ice pack for your swelling. Is there anything you need from me before I leave? No? Okay.